So hello everybody. So today we're going to actually talk about the ventilations and perfusions coupling. We'll discuss that. Okay. I've already pre-done all these graphs, and as we go, it'll make more sense to you guys. But the way we're going to start is from here. Actually, what we're going to talk about first thing is that how the blood flow, how the blood is going to the lungs, and how the blood is going to different parts of the joints, and also we'll compare that with how the air is also playing a role, because we have to talk about both ventilation perfusions in the lung first, and then we'll talk about we'll take each. And this is like each alveoli and perfusions, and we'll talk about each one of them. But here, as you see that I already draw this, this is here. This side is going to be the pulmonary, the artery side. This side is okay. Let me just write down here pulmonary artery side, which is from the right ventricle, right? And then let's make this as okay. It's bringing the. This is going to be my pulmonary. The vein side, and then this is, let's just make this as in the middle here, this is what the extension is going to happen, right, to the capillaries, all right? And then usually functionally the lungs are divided into three different parts, which are like this zones right here is called like zone number 1. Let's just write it down here. Okay, this number 1 is called zone number 1, and this is going to be your zone number 2. Let's just write down this part whole. Okay, let's just make it here actually. This is going to be my zone number 1 right here. All right, let me just write down the 1 here. And this whole part right here is going to be my zone number 2 right here. And this part from here to here is going to be my zone number 3, okay? So functionally, that's how they're divided, right? Now, whenever we talk about the ventilation perfusions, one other thing that I would like to tell you is the ventilation means it doesn't mean that how much air is actually in your lungs. Ventilation means how much air that is actually participating in a gas exchange, okay, per breathing. That's what it means. Same with the perfusion too. It doesn't mean how much blood is there. It's just how much blood is perfusing. It's participating in gas exchange, and that's how we determine the ventilation perfusion ratio. Okay. Now, before even we get there, right, there are a couple of things that we have to talk about. Is that there are a couple of mechanisms we have to understand, because look, as we know that your lung is a lower pressure system, and also it's a low resistance, okay? So because it's a lower pressure and low resistance, what happens is that one of the key factors is, let me write it down in here, big thing, it's very, very important that we have to understand, is that the gravity plays a very, very important role, because of low pressures and low resistance, the flow through all these blood vessels are very susceptible to the gravity influences, right? We'll talk about that, right? And other things we also have to talk about is, okay, this has the gravity, right? But we also have to talk about something called a Starling resistor. What does that mean? We also have to talk about that, okay? And then the other thing, also mechanisms we have to talk about, the other thing is that we have to talk about this guy named, what is this? Pulsatile equations. I don't know how to spell this, but when I talk about this, you guys will know. And obviously, you also maybe, if you want to know, we have to, or when we talk about it, we also, maybe you can mention about the Ohm's law too, if you want to know. All right, Ohm's law. All right, and let's start from the Ohm's law. What is Ohm's law usually says? So basically, the whole idea. So we'll talk about this 4 phenomena whenever we're talking about how blood is going to each part of the lungs. Because remember, this part right here, we said this part is apex of the lungs, okay, and this is the base of the lungs, and this is the middle of. So it's zone 2. We can say, okay, this is the middle of the lungs, okay, and then we can say this is apex, and this one is the base of the lungs. So we divided this in like 3 different sections, okay? Zone 1, Zone 2, Zone 3, right? Now, so each one of them we have to talk about, like what each one of them play a role. So, you know what Ohm's law says, right? Ohm's law is basically, what are they saying? Ohm's law is like, basically it's like looking at the circuitry, okay, the circuitry, and looking at what is the flow of the current in the circuitry, and if you want to find the current, the flow of the current in your circuitry, that it should equal to your voltage differences between two voltage differences over your electrical resistance. Okay, that's how the Ohm's law described in physics, right? But this same concept was actually applied by this guy called Pulsatile equation or something. So what he said is that, okay, this resistance, basically what he said is, okay, let me write it down. Let me actually erase this and we'll just write down right here. What he said is that, okay, there is going to be, if you want to find the flow, let's just try to, the Q as a flow symbol is equal, so this is a perfusion before, yeah, so blood, the Q is equal to, I have to find the pressure differences between the one side and the other side. So basically, I have to have a difference between pressure number, what is this? Let's say this is going to be my, upstream and then downstream effect. You could say simply like that, right? So I need to find the P, the change in P, okay, over, okay, I need to know the resistance of it, okay? So that will distinguish my flow. And what also he said is that, okay, but the resistance itself depends on what? He said, okay, it's it, and then you have N, which has got the viscosity of the fluid that is moving, and then the length of that blood vessels, and then over you the pi to the radius 4. That's what he said. Because this is very, very important. It plays a very important role because there's a powerful relationship between radius and resistance. Because if you decrease your radius, you're going to have increase in resistance, right? Because whenever you decrease radius, what's going to happen? The internal diameter decreases, right? So because of what, resistance goes up. But then if you put this, and what he did was, if you put all this equation down, what he did is like, okay, the flow, okay, let me write down right here. Follow this one, okay? The flow is equal to, okay, I have a change in P, which is the pressure change between the one side of the blood vessels. Okay, and basically, look, this one, we're applying this in a pulmonary, in our respiratory systems, but basically, we're talking about the fluid movements, okay? The blood movement we're talking about. Same thing as your delta P over, if you rearrange these equations, what he's going to get is that, okay, the flow is equal to or directly proportional to that times to the radius to the power 4 over your 8 and the viscosity of the length. So your flow is inversely proportional to the length and the viscosity, because if your blood is viscous, what's going to happen with the flow? The flow is going to decrease, right? But look at the radius. But you have to remember that there's a very, very beautiful, powerful relationship between the flow and the radius though. Because if your radius is decreased, okay, as I said, then the flow would also decrease. But remember, flow would decrease by the power of the force. That's a very, very powerful relationship in the flow and the radius. That's what that he said, okay? And we'll talk about what does that mean, because if you apply this with this one right here, because usually what happens is that your flow is determined by the pressure gradients between the two of this. Let's say this is my P1 here and this is P2 right here. Usually there's a difference between these two, and that pressure gradients actually determines what's going to be the flow here, right? Flow to the flow that blood is going to move here. So usually that's what this is telling you. So if you decrease your radius, like lights right here, if you decrease radius, what's going to happen? The flow is going to decrease, right? That's what exactly we're talking about here, okay? And that's what this guy explains you too. Okay? Now, but there's another concept called startling resistor concept too. What does this mean? Meaning that if we quickly talk about this understanding right here, let's bring this as, okay, this guy, which is a blue, it's being a deoxygenated blood from the pulmonary arterial side right here, okay? And then we'll make this in a pink, and let's make this pulmonary capillaries right here, alright? Like pulmonary capillaries right here. And then we'll make the red, we'll make this as let's say, this is going to be the pulmonary vein side, which being the oxygenated blood, right? Look, usually pressure is, as I said, there's going to be the pressure gradient between your P2 and P1, right? But sometimes what happens, so let's say this as, okay, let's say that if there are external factors, okay, which is compressing or causing are coming in between this, let's say, blood vessel, that means there could be disturbance to flow as well. Okay, and that's what the stalling resistor basically says. It's basically, okay, what happens if, let's say, there is a something, let's say, for example, our case, alveoli, okay, is compressing this because there's a higher pressure in alveoli. What's going to happen is that, look, in that case, what happens, this external factor, okay, is causing the flow to get disturbed. So because of what happened, there could be no flow to that system. That's what this stalling resistor is telling you. Okay, that's external factor that causing the alveolar vessel, in this case, the capillaries, to compress. In that case, the flow is all, because that's going to create resistance, right? So that means what happens when you compress it? What happens? The radius decreases, right? If the radius decreases, what's going to happen? If the radius decreases, because when the radius decreases, that means if your flow decreases by the power of the force. That's what these stalling resistors are just saying. Okay, this is a general concept, but we'll talk about this, okay, down here. Now, at the same time, we also have to talk about gravity too, right? So now, there's some of the stuff that I wanted to mention to you. But now, I already quickly mentioned gravity, but let me erase this and let's go to flow. And then we'll talk about these 3 different types of lungs, all right? Now, let's erase this part, all of them, and then we'll talk about it, right? Now, if you think about this, look, from here, the right ventricle is pumping the blood, right? And usually what is the pressure what is the mean arterial pressure, okay, of your pulmonary artery, right? That is usually about what? That is about like 15 millimeters of mercury, right? Like 15 millimeters of mercury. That is usually the pressure. In this pressure, what happens is that in this pressure, which is pretty low pressure, your blood flow is moving to all those different parts of the lungs, right? Apex and the middle and the lower zone too, in this flow. And if you look at the length of this lungs, usually the entire this length of the lung is what? It's about, they say it's like, it's a 30 centimeters, okay? So if we make this all this down here, okay, all the way down here is about like, up to base, like apex to base, it's like a 30 centimeters. 30 centimeters. And that is the length of the lung, okay? And the pulmonary artery that actually goes into the hilum of the lung, which is the middle of the lung. Let's make this as right here. This is the middle of the lung right here, okay? This is the hilum. And if this is the middle of the lung, then what's going to happen? What's the difference between? There will be a 15 centimeter, okay, of the water, okay? That's, length of the difference, the 50 centimeter of length, difference between, okay, this is going to be what? The apex is going to be less than 15 centimeters than the middle zone, and then middle zone, this base is going to be 15 centimeters, or you can 15 centimeters of water, okay, right here, let's just say this is a length, right? It's going to be not the 15 centimeter more, right? So altogether, with the apex and base, there will be a 30 centimeters of differences, right? Now that's what basically this I'm telling you, okay, the length of the lungs, okay, and then okay, and remember that your 2 lungs, that's the middle, your heart sits between the 2 middle of the lungs, right, at the middle of the mediastinum, right? Okay, so now what happens is that if the blood needs to go like right here, okay, right in this case, okay, we have to. Let's just make this in the blue color. I need to generate a pressure right here. Let's just make this right here. Let's just submit along. I need to have a pressure, okay? I need to push the blood. I need to have a hydrostatic pressure that is more than 15 centimeters, okay? In order to push the blood in. But my pressure is already like 15 millimeters of mercury, right? So in that case, or like, I'm giving exact number, but usually it's going to be 15 to like 19 millimeters of mercury, okay? So if I need to have a hydrostatic pressure more than 15 millimeters of mercury in order to push this blood into the apex, okay, I need to have that. All right. So if you look at this, if I look at this, so but if I need to have that, and what happens is that when they try to push it, the other factor comes into play into it too, because it doesn't have enough pressure to push up, okay, because you need to have greater than 15 centimeters, and this don't have 15 centimeters. So the pressure is going to be relatively low here, maybe like 0 or maybe 1 millimeters of mercury. The pressure is going to be down there, up, right? Or at the same time, what is happening is that the gravity is playing a very, very important role if you're actually standing position, because what happens? Gravity will, the way the gravity will has a downward effect. So it'll push it down. It's trying to go up, but it's going to go against that, and then it'll push below. So gravity is gonna have direct influence on the pressure down here. So that's even gonna decrease it. So it's gonna go, the flow, the gravity is gonna cause this blood flow not to move upward. That's the one thing. So one is the gravity factor, as I explained, right? Okay, there's already lower pressure, one, and other one is the gravity effect. Okay, causes the blood flow to even go down, right? And other thing is that, look, you have to also understand other thing is that whenever, that is, I'm talking based on perfusion right now, right? Other thing is that what happens is that, you know, whenever the air comes in, what usually happens is that diaphragm contracts, the intermittent pressure goes down, right? Let's just think about at rest. What is my intermittent pressure normally? It's about what? Like negative 0.25 to like 5 centimeters of water, right? Let's just say negative 4 centimeters of water in our case. That's my intermittent pressure, right? That is my intermittent pressure. So, okay, what is going to happen is that with this intermittent pressure, it is trying to what? It is trying to expanding the lung, right? It started expanding the lung. So, if my lung is expanding, okay, so this is going to be, look, from here, because of my intermittent pressure, and then also the gravity influence, so what it's going to do is, it's going to try to push. So this is going to go downward, okay, and also this is going to go, the layer of the alveoli is, the pressure down here, that's also trying to go down, and then this intermittent pressure moving upward. So you're going to have a stretch like this on downward side, and this is going to up here, it's going to go stretch upward. So because of that, there is going to have a negative intermittent pressure here, but that's going to be higher. That's about like going to be like negative 10 centimeters of water. That is going to be my intermittent pressure down here. Let's just write down. That is going to be my pleural pressure, okay? Okay? And then remember, this pleural pressure is causing to have a higher negative interpleural pressure, which means that if you have a higher negative interpleural pressure, what's going to happen to my transmural pressure? Okay, that's probably going to be, remember, the transmural pressure, that's going to be what? That's going to be like much more positive, right? That means this alveoli, I already made it. It's going to be, this is expanded, okay? Already it's expanded. Already it was more compliant, okay? So because of that, what happens is that in the upper position right here, you're going to have a bigger alveoli, okay? That's going to have a bigger alveoli. So let's write it down here. So what are things here going to be here? So a couple of things. Let's write in OPEX here, okay? In OPEX, number one thing is, okay, there's a gravity effect, okay? Because of that, there is a like more or higher negative interpleural pressure. Okay, that is number one thing. And other one is what? Very, 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 very low pressure that is going there, okay? Okay? And because the gravity is also, and gravity plays an influence role into it. And that's going to be a higher transmural pressure. Because of that, what happens? The lung, the alveoli is already distended, so you have a bigger alveoli, okay? So if you have bigger alveoli, what's going to happen is that, this bigger alveoli, what's going to do is that they're going to come and compress this capillaries now. See, like we can say this, they're compressing the pulmonary capillaries. So because it is compressing the capillaries, and there was lots of air, bubbles are here, what happens is that this pressure is going to be the factor that's going to determine, okay, this one and this pressure right here, which is the extra alveolar vessels, which is going to be my pulmonary artery, okay, that is going to play a role. That's when you have the pressure gradient between those two now. And normally what happens is that, in here, you're going to see, okay, in the apex right here, you're going to have this pulmonary, let's just write down, where should I write down? The pulmonary artery, obviously, I'll be right somewhere. Okay, let's just erase this for now, okay? And we'll draw this again. Normally, what happens in the apex is like, you're going to have, because of that, your pulmonary with the big A, okay, is going to be greater, okay? The pressure is going to be greater than the pulmonary artery pressure, okay? with a small a, and then pulmonary vein pressure. That's what you get to see on my this guy. What is this called? In my opex, okay? And even in the whole cardiac cycle, this zone, we functionally, we say it's like no flow, or maybe minimal flow, we can say sometimes, okay? But usually it's like a no flow zone. That's why we classify this as, okay? And we'll talk about that is what is that. So that's going to give you a VQ mismatch. We'll talk about that means too. Now, and even in the whole like cardiac cycle, even the systolic phase, okay, what happens is usually the blood flow is minimized there, or there's no blood flow. One of the reason is because the blood vessel, what happened is that it's less perfused. The blood flow to that is low right now, because that's what he's saying, right? The blood flow is very, very low. Okay, so because of that, what happens is that it's going to be less perfused there, okay? Now, let's talk about the middle zone. The middle zone, we have to talk about this one. Well, the middle zone is like, look, now, the pressure is about 15 centimeters of mercury, right? So, it's good. And then you have an interpure pressure is about here, like -4 centimeters of water. That's going to be my interpure pressure here. And let's just write on the base too, which is like about negative 2.5 centimeters of water. That's the base, the pressure you get to see on down here. So if that's the case, then we have to talk about a couple of things right here now. Now, if I case, what's going to happen? Now we have to talk about, again, what is going to be interpure pressure down here? It's a -4 centimeters of water, okay? That's good, all right? Because that means they have to have a little more compliancy. And other thing is that whenever you increase, let's say, cardiac output, what happens is that, look, this pressure can go up, right? So the pressure can go up, and there's a capillary recruitment can happen, okay? And because of capillary recruitments, the more capillaries can come, and those capillaries have what distensibly, there can be distensible, right? They can be more compliant. So in systolic phase of your cardiac cycle, because of capillary recruitments, so there could be a blood flow there. You see what I mean? So in that case, what happens is that you could have, we call this as intermittent, okay, or pulsatile flow there, okay? Intermittent or pulsatile flow. So in that case, what happens is that, okay, you're going to have this blood vessel right here, your pulmonary artery, okay, we'll just write pulmonary, your artery, that is going to be, that pressure is going to be greater than your pulmonary alveolar pressure, okay, and this pulmonary alveolar pressure is still going to be greater than pulmonary vein pressure. The reason why is because because the pressure is going to be more compliant in capillary recruitment, there's going to be increase in flow, or there's going to be intermediate in flow, and also you have a -4 centimeters of water interpure pressure, and what means is that their transmural pressure is relatively lower compared to the opex, okay, because in a opex it's probably could be like 10 centimeters of pressure, okay, if the alveoli is 0 there. Then, if that's the case, then the transmural pressure is about like 4 centimeters of water. It could be that. In that case, what's going to happen is that, okay, it still is higher, but what can happen is that this interpure pressure, whenever there's, remember, interpure pressure is affected by your what? Interpure pressure can affect your extracellular vessels, right? So pulmonary artery can also dilate, right? So because of what flow increases here, in that case, that's the reason why what happens, the pulmonary arterial pressure will be higher than pulmonary alveolar pressure, but still at the venule side, it's still what happens is the capillaries are still like little semi-constricted. But even with the semi-constricted, there's still a blood flow during the systolic phase. That's what happens, okay? That's the intermediate or middle zone we're talking about here now. All right, this intermediate and the middle zone right here. Huh? Now we come back to our base area. In the base area, we have to talk about what is happening here. Again, one is that, okay, what is happening here is that, okay, the pressure down here, look, if the gravity is pulling the blood, okay, so if the gravity is pulling the blood, what's going to happen here? This is going to be what? If the gravity is going to be overperfused, right? Overperfused is going to be, or it's going to be lots of blood is going down here, and also the pressure that's going to be, so that means it's going to have a good flow here, right? On the base. Other thing is that, okay, what is going to happen during what is going to happen to the airways? Remember, the gravity is pulling down from here. So because of what happens, this airways were smaller. Okay, it was compressing. You see what I mean? So it was compressing, and also the blood flow is greater in the base. So both ventilations and perfusion, blood flow and air is both are greater in the base, and because these alveoli are small, okay, because of the gravity effect, what happens is that when you take the air in, what happens is that this alveoli can get compliant. They can get bigger. They can get stretched. Okay, they can get stretched. On the lung here, on the apex here, it's always stretched. So when you take the air in, it cannot get more distended here. But this alveoli is compressed here, right? They have this small airways, so they can have more compliant. And plus the transmural pressure is what? If it's interpolated pressure -2.5, the transmural pressure, if you compare from upper to lower, this is relatively lower, right? So because of what happens is that there is going to be a good flow here, okay? So in that case, what really happens at this base is that, okay, this is middle zone, okay? All right, let's just write down, this is middle right here. This is middle, and this is just your base here. So in this case, what happens is that your pulmonary arterial is going to be greater than pulmonary vein, and the pulmonary vein is greater than your pulmonary alveolar pressure, okay? So this is what he's doing, and this is called, you can simply call this as a continuous flow. Okay, there's a continuous flow happens, okay, here, continuous flow. That's what happens at the base. All right, now, so that's why, like, the couple of things you have to understand. The pressure gradients, number one, okay, the gravity fact, okay, and whether it's external factors are influencing or not, the systolic register, okay, you have to look at all those different things in order to look at this zone, okay? Now, let's talk about a couple of things here, okay? You know, to be honest with you guys, like, you know, the one more things I also have to mention, like, okay, let me not erase this part. Okay, let me erase this part right here, but we'll draw this again. What happens here is that we have to understand a couple of things. You know, there's a height I was talking about. This is the height, okay? As I said, there's like going to be like, okay, the 15, like about like 30 centimeters, okay? One of the things you have to understand is, like, you know, you have to know, you know, as you go down, what happens is that both ventilation and both perfusion increases, okay? Because that's what's happening right here, right? So if you look at the upper zone right here, apex, right? What is happening here is, okay, there's a ventilation right here, right? There's a lot of air there, right? Air was getting trapped into this. And then there's a good ventilations, okay, but there's a less perfusion there, right? So if I make, actually, let's make a graph here, actually, and then we'll talk about this. If you make a graph of this, okay, and we'll make it here, and this one we'll make it as a base here, and we'll make it apex here, right? And we'll make another point down here, and we'll write down the VQ ratio too, okay? This is VQ ratio, and we'll write down here 1 here, write down 2 here, and we'll write down 3 here, okay? Now, we'll talk about the VQ ratio later, but we'll write down here flow, okay, per unit time. That's what you will write down, okay? Because that's what happens. So, like, if we look at this, okay, and we'll write down, okay, what is going to happen here? Okay, so let's make this as this. And we'll go from apex to base, right? So what happens is that whenever you're coming down from up to down, okay, you're going to see both increase in ventilations and also increase in perfusions, okay? But what happens is that but only difference is that the rate is different from both of them, because the blood flow is equal to, if there is a 1 centimeters of water difference, okay, if that's the pressure, okay, then that it's equivalent to, or 1 centimeter of water is actually, is because the height is like about like what, 30 centimeters, 30 centimeters of water or something. So if that's the case, then 1 centimeter of water, that is equivalent to the 1 centimeters of the height. That's what it is, right? That's the reason why, okay? Or if you think about, so this is the blood flow. The 1 centimeters of, let's say, the perfusions is equal to the 1 centimeters of the height differences, okay? That's what you get to see in there. But when it comes about the ventilation, the rate in which it increases like about 0.5 to the rate that is going to be 0.5 to every like 1 centimeters of height difference, okay? That is a flow. That is a rate in which the flow is moving. So every 1 centimeter height, okay, there will be the 1 centimeters of the perfusion difference, okay, the blood difference, and then every 1 centimeter there will be 0.5. The movement of the rate of the movement of this air would be that. So that's the reason why your flow when it because of gravity effect. I'm talking about gravity effect. So because of what happens is that at the base it is what it is. Like you could say it's going to be more perfused than the ventilations, okay, and at the apex, what happens is it's going to be more ventilated than it's perfused. So if I make a graph, what's going to happen is that if I make the perfused as it going from from base to apex, okay, the base you're going to have a pretty much like a really high, okay, really high, a rapid perfusion. But then if you talk about the blood flow, it should look something like this, okay, and then the VQ mass will be around let's make this as a 1 right here. Okay, so it should look something like this. So you will have this tells you about the perfusion right here, or Q, and this tells you about the ventilations. Okay, so the rate of the graph is saying basically the rate of the movement of those the flow. All right, now after this we have to talk about some other stuff too. What is some of the stuff that I have to talk about? Is that let's just talk about quickly. All right. Now, some of the cases that we have to understand is that, okay, so far we've been talking about the gravity effect, right? But, okay, what is going to happen? This is in upright positions. But what about when you're supine position? Whenever you're lying down? Whenever you're lying down, what happens is that there's still going to be gravity effect, but your blood flow what happens is distributed all different types of zones, because these zones can change too, okay? Depends on the positions, what position you are. So when you're supine position, we no longer think about an apex and a base. We think of more in anterior position and posterior positions, right? And in that case, what happens is that your blood flow are increasing your central organs, right? And your central circulatory systems and the blood flows are decreasing in your lower legs. Because of what happens is that, okay, there is going to be what? There is going to be obviously increase in blood flow. So whenever increase in blood flow, there's probably increase in cardiac output there too, right? And what happens is that in that case, in the supine position, in the anterior posterior position, what really happens is that maybe, look, the zone 1, which was early on, it was non-functional, right? It could become your zone 2 that time. You see what I mean? Or your zone 2 would probably be your zone 3. So there is changes that you get to see, okay, during your supine position, because the blood is going to be evenly distributed that time. I mean, not evenly, but it's going to be, it can change, okay, in anterior positions. So that's what is going to happen, right? Now let's just talk about one more thing, okay, a couple of things. What happens, look, let's say, when you're exercising, okay, as exercising, you have increase in cardiac output, right? Increase in cardiac output. So if you have increase in cardiac output, then what's going to happen? Okay, that means if you have increase in cardiac output, maybe in that case, okay, which is the same thing as the zone 2 can become zone 3, right? Or zone 1 can become zone 2 that time, okay? Zone 1 maybe become your zone 2 that time, and your zone 2 can actually become your zone 3. And remember, zone 3 is what? That's what the best perfusions and best ventilations are going on there, right? So that's you can see changing when you have an increase in cardiac output or so. Let's change the scenario. What about if you are hypovolemic or you have a decrease in cardiac output? Let's say if you're decreasing cardiac output right here, okay? If you're decreasing cardiac output, then what are the changes that you get to see then? In that case, okay, if you're decreasing cardiac output, that means what's going to happen, what is going to be reasonable changes you get to certain zone. If you're decreasing cardiac output, that means you're going to have decrease in pressure. If you're decreasing pressure, what's going to happen? And also the gravity is going to play a role to pull the blood down. So that means, look, whatever that was intermittent flow, there was happening during a what? Increase in cardiac output, right? In systolic, right? But if you decrease cardiac output, this zone 2 can become what? Zone 2 can become your zone 1 in that case. And then this is zone 2, right? Right here. And then your zone 3 can convert it into your zone 2. That's how it can change. Okay, this is how it can change this. Okay, and this is usually because when you have a lower cardiac output. All right, now we talk about some other concept too, and that's one other concept we're going to talk about is let's just talk about quickly about some other thing, and that is, okay, what about, there's one more thing, what about, let's say, not only the low cardiac output times, but if you want to be actually, very, very good with this kind of stuff, long, we can divide this into long, not only 3, we can divide into 4 different zones actually. So let's write down 4 different zones, because in the 4 different zones, what is happening here is that, okay, the lungs, you have this blood vessels, okay, the external factor is playing a role here too, okay, something else is compressing this guy. And what is this compressing this guy? That is the fun part to know, right? So what is going to happen is, let's just make this as a compressing point, okay? And then we'll make this as what? And then what happens is that, all right, we'll make it here different terms like this. What is playing a role here is that positive, your increase in your interstitial pressure, okay? Interstitial pressure, okay? So what happens is, this is a zone 4, you can say. What happens is that usually, okay, because, okay, interstitial, what happens is that the pulmonary artery is the small a, okay? The pressure down here is still going to be like higher here, but what happens is that when you have interstitial, that's pressure is higher. What kind of effect that's going to happen is that because it's compressing the capillaries down here, it's causing that, okay? It's causing decrease in intrapleural pressure. So because of what is going to happen is that, look, that's going to happen is that you're going to have a higher pulmonary interstitial pressure now. That is going to be higher than your pulmonary vein pressure, then that's going to be higher than your pulmonary alveolar pressure. That's what you get to see, okay, in zone 4. Pulmonary arterial pressure is going to be higher than pulmonary interstitial pressure, okay? And because this is positive pressure that is actually causing this external factor that is causing these compressions of these capillaries. So because of what happens is that, that it's still going to be like the flow, but that could be caused. But you this is what you get to see. And remember, one of the important factors is that you usually get to see this in some of the clinical conditions. Like, what are the clinical conditions? Whenever you have, let's say, what is this? Atelectasis, right? Or something. Atelectasis, I can't pronounce this, which basically means a collapsed alveoli, right? Alveoli, or collapsed lung, right? So whenever you have that, what is going to happen? You will have probably a decrease in what? Alveolar pressure, right? And then what is going to happen? You probably have different, you're not probably not take, if it's a positive pressure, if you're decreasing intrapleural pressure, you're probably not going to take the air in, right? Much more so than you have a decrease in tidal volume, you probably have a decrease in breathing, right? So decrease in your probably alveolar ventilations. So whenever you have decrease in alveolar ventilations or decrease in your alveolar pressures, and when the lung is collapsed, okay, what's going to happen? The interstitial pressure goes up, right? Interstitial pressure is going to be higher. Okay, in that case, what happens? Zone 4 plays a very, very important role. And in this pathological condition, you get to see that. And one of the key thing is that if that's the case, happens because of the lung collapsed lungs, you're going to have decrease in lung volume, right? Because of that, you have decrease in lung volume. And it makes sense, right? Because when you collapse lungs, okay, lungs, you're going to decrease in alveolar tidal volumes. It makes sense that it's going to have a lower lung volume, right? So when you have in that case, what are the switches that you get to see this? In that case, maybe you probably don't even get to see, you probably see more zone number 2 and 3, and then you see a lot of zone 4, okay? Lot of zone 4. You get to see that because this is what you get to see on a zone 4, which is going to be pulmonary arteries are higher than pulmonary interstitial pressure, and in this case, right? Now,